50, 60 years ago, patients with trisomy 21 or Down syndrome were also allowed to potentially not get medical interventions and died in our NICUs without getting treatment because it was felt at that time that the disability was so significant that these children had no chance at a quality of life that was reasonable. And nowadays, no one would consider that acceptable. And that just goes to show that not just medical knowledge evolves over time as we get better data, but understanding about disability and what that means and how we can support these children is also evolving over time. And again, that just sort of makes these decisions harder. It was easy 70 years ago because there was no decision to be made. And now it's so much harder because there are choices involved and we have options. We have support systems. We have medical tools that we didn't have. So, it's harder for everyone nowadays.
One of my mentors in bioethics, so you probably know Dr. Jeff Bodkin, who was on
Mhm.
faculty here at University of Utah. Now is like me, retired but still working, and Jeff's been a part of the AAP's bioethics decades ago. He said, and I know it's only when you have these choices that the ethical dilemmas arise. I'm not saying it exactly the way he would have done. Is we have the choices, and so I think you pointed out quite astutely that our challenges in being able to convey in a short period of time what the challenges are for a family, and I think and you characterized it nicely in talking about the disability part and how that enters, and the other, which we've talked about all morning, is the medical complexity, is having a family be in the position to understand what that path means, and to do that realistically. Uh, I've struggled with that over the years as we even have used medical complexity more as a descriptive term. But what I came to and I'd be interested to see what you would think, Dr. Pyle, in our own fetal center and all along, even counseling families, especially in the NICU, I always felt it was important for me to add something about the joy and positive aspects that I've seen in the families I've known in Utah and at soft conferences. Yet I knew how to script that, how to actually say that and say it and, truthfully and genuinely, um, to balance what is all of those challenges is to me still a challenge. And I've had parents say in the fetal care center 2 times I can remember vividly, where one of the parents would say, "You've actually made my decision more difficult." By saying that, and then you can see why. And so maybe there are other words that we can bring in, because some of this is hard to actually put into words. But anyway, I'm so glad you brought up what we might call the disability part, and you're totally right about history and Down syndrome. When I was a pediatric resident in the early and mid 1970s and a fellow in the late 70s, our surgeons still offered to families of children with Down syndrome who had a blocked esophagus for whatever reason, duodenal atresia, tracheoesophageal fistula, the option of no surgery, which meant that basically the child would only have IV fluids as far as hydration. I won't say anything more about what that would mean because it's clear. But I did see that particular event. I'm talking about it now. Maybe it had some influence on me, but um,
No, I was just going to echo what John was saying about finding the right words for the families is an ongoing challenge, and different families, I think, respond to different words, and so there's no one size fits all there.